All right. Hi there. Sorry we're a few minutes late. We had a little technical glitch earlier. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you the February 8th update on the impact of the COVID-19 pandemic on Mobile County. So just to sort of recap where we are worldwide, there are 106,314,000 cases of COVID-19 around the world, and just staggering number of cases that have occurred. In the U.S., just over 27 million cases of COVID-19, and in Alabama, approaching 475,000 cases. So we're just over 473, 348 right now. Worldwide, there have been 2.3 million deaths, 464,000 of those occurring in the U.S., and 8,523 in Alabama. In our daily COVID report today, we're reporting on 34,317 cases of COVID-19 that have occurred since we had the first case reported to us on March 19th of last year. Yesterday, 156 cases were added. On Sunday, 72, 191 on Saturday, and Friday. So again, 156 cases added yesterday. The number of people who've died with COVID who lived in Mobile is at 656. That's an increase of 7. And remember, I've mentioned that the daily increase may include COVID cases and deaths that occurred in previous weeks, but were only recorded in the last 24 hours. So a total of 656 deaths with COVID. The cumulative number of people hospitalized is 4,354. That's an increase of 27. And then when we look at how many people were in the hospital yesterday with COVID-19, that number is down by 4. The total yesterday was 173. So as we have been discussing locally and nationally, you've probably seen in the news, our numbers have declined after the peak that we saw the week of January 3rd. So again, this wave that we're in now, this unprecedentedly high number of cases and hospitalizations and deaths is due to returning to school, going back to work, reduced restrictions on public spaces, gatherings around the holidays, sporting events, those sorts of things. That is what resulted in the very high number of cases and deaths in December and January. And so now that things are going a little bit back to normal, we need to make sure that we're vigilant in reducing interactions with people who don't live in our household. So again, we have to implement and stay diligent about avoiding gatherings. That is the only way we're going to be able to keep the case count down until we can get enough vaccine in people's arms to reach that holy grail of herd immunity by getting 70% at least of our population vaccinated with COVID. So again, just want to reiterate, our daily report, our daily expanded report is out today as well. Last week there were around 970 cases reported in all. That was a decrease from the previous week, but still has not returned to levels that we saw before Thanksgiving. So we still are at a very high number of cases and hospitalizations, though it is improving. Let's see. The number of the number of people hospitalized on any given day with COVID-19 has also been declining for several weeks. We're very happy about that, to provide some relief to our hospitals, who are now not only coping with COVID, but they're trying to get as many people vaccinated as possible. It looks like emergency department visits for COVID are going down, and we've seen a bit of a plateau with the number of deaths, but remember, there is a lag in receiving information about deaths that were attributed to COVID. We generally don't find out about deaths for sometimes weeks or months after they actually occur. So let's see, the percent positive in our report looking at the statewide surveillance system, which is a combination of PCR and antigen tests, that those combined, we have about 9% of our laboratory tests are positive, but we know from data looking at our partners and when we're just looking at antigen tests, those antigen tests are the rapid tests, and when someone is sick with COVID and thinks that they have COVID, they want to know right away. And so when you look at our data, if we're just looking at the antigen results, the percent positive is from 5 to 25% higher than the statewide number that we get from our traditional system. So we're reporting 9% this week. It will go up a little bit after we get some more information, but the antigen test positive is still up around the high teens or low 20s at our testing facilities. Just want to remind schools that we have localized outbreaks. We have 582 cases per 100,000 people added over the last 14 days. And again, percent positive is floating around that 10% mark. So these are all indicators that schools should continue to be resilient or vigilant in implementing social distancing and wearing masks in school locations. All right, so I just wanted to remind you a little bit about the vaccine effort going on this week. So we're very excited that on Friday, the State Health Department announced a push this week to try to accelerate COVID-19 vaccine in Alabama, and that mass vaccination clinics are going on in all 8 districts of the state. These are public health districts. Mobile is considered a district on its own, so Mobile County is also Mobile District. And these vaccines are going mostly to hospitals, the extra vaccines. And we actually had an event today. We gave just over 400 doses today at our Mount Vernon at Belsall Middle School. So that was a great success to get those vaccines out. And we're really excited about what our community partners, our community hospitals are doing to try to, sort of everyone rally together to try to get some extra doses in the arms of people in Mobile County. In Mobile this week, you can go to the ADPH website and find a link to all the locations. But in Mobile, Providence is working out of Dayspring Baptist Church by appointment only. So you have to go to their website to register. Infirmary is providing mass vaccination at Pro Health Fitness Center, again by appointment only, no walk-ups. USA at the Mobile Civic Center by appointment only. You can visit c19vaccine.southalabama.edu to get information there. Spring Hill Medical Center is by appointment only, also no walk-ups, springhillmedicalcenter.com. So let me restate those. For Providence, it's getprovidencemobilecare.com. For infirmary, it's by appointment only. Call 251-341-2819. For Mobile Civic Center, by appointment only. COVID-19 vaccine.southalabama.edu. And for Spring Hill Medical Center, by appointment only. springhillmedicalcenter.com. So we're just really excited that this is going on in Mobile County this week, and hopefully by the end of the week we'll be able to share some numbers with you about how many people were vaccinated in Mobile. I can tell you, generally, about 40,000 people have been vaccinated in Mobile so far. That is a combination of first and second doses, though probably 60 or more % of those are first doses, since we're just now started giving second doses in mass. I'm wearing my button that I've completed my vaccine. I've got my primary and my booster dose, so I have completed the series. And this week, the health department will be providing several thousand second doses, and we're really excited about that. So we can't wait to tell you at the end of the week how many people we helped complete their vaccine series for COVID-19. We'll try to do that when we talk to you again on Friday. All right, so we don't have any questions today, so I will end my remarks there. Just one more thing, just to reiterate, I know that, everyone's tired of being told to wash their hands and wear their mask, but it's really important that we continue doing that. You've seen information about the COVID variants that are out there. We're just learning more information about how effective mask wearing and how effective the vaccines are against the COVID variants. Just to remind you that getting tested for COVID is also a tool in our arsenal to slow transmission. So if you want to get tested, if you think you've been exposed, if you're sick, please get tested for COVID. There is still plenty of testing in our community. For the health department, you can get tested at no charge to you by calling 251-690-8889. So get vaccinated, get tested, wear a mask, wash your hands, stay at home if you're sick, do not gather with persons that don't live in your house, and we can all continue to work together to slow the outbreak, protect our hospitals, and protect our loved ones and community members who are at greatest risk of complications and death from COVID-19. So thanks, everyone, and we'll talk to you again tomorrow.